Hello, I'm Dr. Eliza May Francisco. I am a family medicine consultant as well as a specialist in medical nutrition. So I practice in tertiary hospitals here in Manila and in southern Luzon. And most of my patients are in the ICU or cancer patients, diabetic patients, geriatric patients, as well as pediatric patients. I use ProSource virgin coconut oil for my personal needs, specifically for oral gargle, such as oil pulling, every night. And I've used it for my skin as a topical emollient for dry skin and for eczema. And especially for the calming oil, I use it whenever I'm stressed or at the end of the day when I have a headache and I want to sleep comfortably. For my patients, I use ProSource virgin coconut oil in medical nutrition, and this is not only in the hospital setting but also at home. I've been using ProSource virgin coconut oil from maybe early 2000s, and this was when virgin coconut oil became more popular in the Philippines, and I've been using it in my practice, and I've been promoting it also to my patients and friends and relatives. Basically, virgin coconut oil is an anti-inflammatory agent, and we know that a lot of diseases are rooted in inflammation. So if we have a way of decreasing the inflammation, then we can prevent or lessen the effects of these diseases. So virgin coconut oil can be used as an anti-inflammatory in these cases. Aside from that, it is an antimicrobial for bacteria, for fungi, for parasites. And I've used this in my practice to prevent infections. And when there is already when infection is already present, then we can also add it to the regimen to help the patient ward off the infection, not only through the antibiotics but with the help of VCO. I recommend virgin coconut oil to my patients mainly because it is natural and safe. And nowadays we have a lot of patients who prefer to use not synthetic medications. So when they're under a lot of medications, we try to complement the therapy using natural supplements such as virgin coconut oil. In addition, it has very minimal side effects, if there are any. In my practice for 20 years, I haven't seen much side effects with virgin coconut oil use, except for if they take it too much, or if they take too much of it. Some have reported loose stools, but that's about it. So very minimal side effects. The recommended intake for VCO is 1 to 2 tablespoons or 15 to 30 ml per day. And we can increase this up to 6 tablespoons per day if you can tolerate it. And it's also dependent on the size of the patient and the age of the patient. So of course, in younger patients, I give just 5 ml, ranging from 5 ml to up to 1 tablespoon or 15 ml. For elderly patients, I start at 15 to 30 ml. And similar to adult patients, I gradually increase up to 4 to 6 tablespoons per day. I've been using virgin coconut oil in my practice, specifically for cancer patients with mucositis. So mucositis is when they have mouth sores after chemotherapy or after radiotherapy. And we've seen really bad cases where they couldn't even swallow or chew well because of mouth sores. So I've used virgin coconut oil as a gargle it does not sting like some of the medications for mouth sores. It tastes good. It's not expensive, and patients are able to comply with the regimen. So the outcomes that I've seen, is in 1 or 2 days, there is soothing of the mouth sores. Patients are able to eat better, swallow better, and in the next few days, there's drying of the mouth sores. So in fact, we conducted a study on this on cancer patients and have seen that the effect of virgin coconut oil as an oral gargle for mucositis is at par with the usual mouthwashes that we use. So that's for cancer patients. I've used virgin coconut oil in my medical nutrition practice, specifically for malnutrition. So when patients have difficulty eating, are not eating enough, and are losing weight, that's when we consider them malnourished. They need additional sources of nutrition. And the most calorie-dense food or supplement would be oil. So what I do is I mix virgin coconut oil in their soups or in their milk. This can be for children or for adults. And in doing so, we increase the total calories by 45 to 135 calories depending on how much we put in. And it does not entail a big volume, unlike having to finish, let's say, a whole glass of milk, which is 250 calories. When we put in a teaspoon of virgin coconut oil, that's already additional 45 calories. So I've had success in improving the nutrition of these patients by fortifying their food with virgin coconut oil. So that's for cancer and that's for malnutrition. In addition, I've seen benefits of virgin coconut oil in patients with Alzheimer's disease. So I have a lot of Alzheimer's disease patients who are unable to eat, and we put in tubes like this. So this is a stomach tube or a peg. So it's placed here, and the feeding, which is mostly milk, is given through here. So when these patients are constipated, we put in virgin coconut oil, and that has helped. And for my Alzheimer's patients specifically, I've seen dramatic changes. The relatives would tell me the week that we added the virgin coconut oil, their mom was more talkative. When before she wasn't talking, she wasn't conversing or socializing much. And the only thing that we changed was we put in virgin coconut oil. So I was giving, up to now, and I'm giving this patient 15 ml 2 times a day. And according to the relatives, and when I see the patient, I see that she is more interactive, her mind is more sharp, and this is to think that she has had dementia, Alzheimer's for several years. So I think it is the VCO that helped in this patient. And lastly, on the technical side, because I handle patients who also have surgery, there is a condition called Kyle leak, C-H-Y-L-E, Kyle leak, wherein after surgery or in patients with cancer near the lymphatic duct. So lymphatic is like the circulation of white blood. So when that leaks, a lot of the immune cells are lost and the patient is unable to digest properly. So we use MCTs, medium chain triglycerides, which are abundant in virgin coconut oil. And the recommended diet for Kyle leaks in the international guidelines is to use MCTs. So we ask the patient to take certain milk formulas, and we have restrictions, and the only oil source that we use is MCT from virgin coconut oil. So that's for Kyle leaks. So to summarize, the patients that I've seen and have used virgin coconut oil and have seen success, are cancer patients with mucositis, malnourished patients, specifically underweight patients, leaks, and Alzheimer's patients. Definitely yes. ProSource virgin coconut oil is safe for babies. It is very similar to breast milk. The main ingredient here is monolaurin or lauric acid, which is also found in breast milk. And virgin coconut oil doesn't contain any synthetic ingredients or additives which make it unsafe for babies. So I've been mixing it in prematurely born babies who are underweight, and it does not have any untoward side effects. For pregnant women, similarly safe for them because it is like a food. So it's just extra calories, high calories. It can give them energy. It can help them with their constipation because constipation is common in pregnant women. When we talk about safety for pregnant women, we are more worried about some ingredients passing on to the baby. And in this case, virgin coconut oil is safe. It is just a food, and if it goes to the baby, then that would even be better. So I chose ProSource virgin coconut oil as my brand ever since the early 2000s because it is of good quality. It is very affordable for our patients, and it is readily available in most drugstores. I understand that it has organic certification and comes from reputable farms and from a reputable manufacturing company. So that's why I trust my family and my patients with ProSource virgin coconut oil.